Hi, my name is Mike Smolinski, and I'm the managing editor of Neurology Now magazine. I'm here with Dr. Lisa Shulman at the Brain Health Fair in San Diego, which is part of the American Academy of Neurology's 2013 annual meeting. Hi, Dr. Shulman.
Hi there.
Would you introduce yourself a little bit to our audience? Many of them will be familiar with you from the magazine, but just let people know who you are and where you work.
Sure. So my name is Lisa Shulman. I'm a neurologist, professor of neurology at the University of Maryland School of Medicine in Baltimore. And I am involved on many levels with the American Academy of Neurology and the American Brain Foundation. In particular, I am on the advisory board of Neurology Now magazine, and I'm editor-in-chief of Neurology Now patient books. So I've always had a tremendous interest in patient-centered services of all types, and that's why I do this kind of stuff.
That's great. How did you first become interested in neurology?
That's an interesting question because actually I wasn't planning to be a neurologist. And when I was a medical student and doing my rotations, when I did neurology, my first few patients that I was assigned as a medical student really grabbed me. As an example, there was a patient that I admitted, unfortunately, with a stroke. But the thing that really made me just really interested and intrigued was that he wasn't able to speak a single normal word in a sentence, but when he'd get frustrated, he could swear like crazy. And so the only thing he could ever say were these terrible swear words, which made him feel very embarrassed.
Wow.
But the point was that it was an illustration of how we learn so much about the brain by looking carefully at people's symptoms. In this case, that speech, normal speech, is actually separated from the emotional speech of swearing.
That's fascinating.
And I had a patient like that and one other patient, also a stroke, equally intriguing. And all of these are sad situations, but they are so illustrative of how interesting neurology is, because in this case, an elderly man had a stroke and lost the ability to speak English and could only speak a language he'd spoken as a child in Europe. Again, incredible stories. So I started my neurology rotation not planning to be a neurologist, and within 1 week decided this is for me.
Oh, that's really something. And what area of neurology in particular are you interested in?
So you might think from that story I ended up in stroke, but no. I ended up as a specialist in movement disorders, in particular Parkinson's disease, but also other types of movement disorders. And one of the reasons that I'm really interested in that area is that I'm very interested in chronic neurologic disorders. Disorders that people live with over time. Parkinson's disease is an example of that, in that it affects people of a very wide range of ages and then very gradually progresses because we have good treatments, thankfully. And therefore, I'm interested in enhancing the ability for our patients with chronic neurologic disorders to adjust and live well with the symptoms of a neurologic problem. And that's a very complicated thing. You could spend your whole career studying it.
Sure, I was actually thinking that it's a nice segue into my next question, which is, I know that you mentioned as editor-in-chief of Neurology Now book series, it seems like one of the things that the series is trying to do is help people manage a condition over the long term. So you might explain to our audience a little bit what the Neurology Now book series is, and what books you've published so far, and what kind of information they contain.
Right. So a patient magazine like Neurology Now magazine can be extremely timely in terms of you covering all sorts of topics from one issue to the next. But there's still room, even in our information age, for a reference book for people who either have a disorder or have a friend or family member with a disorder and want to have a book that they can go to time and time again. And also that presents a deeper amount of material So our focus in the patient books is very much tied to what I said is my interest, in terms of giving people the tools they need to adjust and then manage to an illness. So we thought very carefully through not doing necessarily the cookie cutter of what patient educational materials do, just providing a lot of information, which is of course important, but instead we have thought through what are the tools and skills that people are going to need to manage one disease or another. And every disease, it's interesting because we tend to think very in isolated ways about epilepsy or multiple sclerosis, stroke, or neuropathy, whatever the disease is. But the truth is that there are some things that are clearly different about each disease, and then there are lots of things that in fact are quite similar across chronic conditions. So an example might be that the actual medications and treatments for each of those disorders are different. But the actual issue of managing the medications and treatments in your daily life is more similar.
Right.
Or maybe the issue of if you have neurologic symptoms, how do you sort of interact with your family, with your colleagues, and so because some people have a sense of stigma or embarrassment because many neurologic symptoms can be seen.
Yeah.
There are some diseases and disorders where they're equally serious, but you can tell people if you wish. If you have a bad tremor, you're not going to have much of a choice about telling. Or if you're not going to tell, everybody's going to be wondering. So there are some distinct differences and things that cut across disorders. We try our best to focus on patient needs. That's the whole concept of patient-centeredness. There's a lot of discussion about that these days. Thank goodness. I've been waiting 20 years for people to get interested in it. And patient-centeredness, a lot of doctors come up to me and say, I don't get it. What's patient-centeredness? I'm patient-centered. That's what I do all day. I see patients. But they don't get it. Because the concept of patient-centeredness is instead looking at managing health through the eyes of the patient. And that isn't something that physicians or healthcare professionals have been terribly good at. They're getting a little better, but it'll take time.
I think it's interesting. I mean, certainly the issue of stigma is one that, it's not always easy to put oneself in someone else's shoes, and that may be something that would be easy to miss. But yeah, I can see for a patient could be a major factor in managing a disease. It's really good to have those books out there books that are addressing those sorts of social and emotional aspects of coping with, I think, a chronic disease. Which issues what topics have you published so far?
Right, so that's important that you should know that just in the last year, we published books on Parkinson's disease. It's called Navigating Life with Parkinson's Disease, and brain tumor, Navigating Life with a Brain Tumor. And of course, there are a number of Parkinson's disease resources, not as many for brain tumor, so I'm particularly proud of that. In the past, we have published many other volumes, including on unusual topics like smell and taste disorders, and more common topics like epilepsy, Alzheimer's disease, neuropathy, multiple sclerosis. There are about 10 by now, so I can't rattle them off, but there are many.
That's great. And where can people purchase the books if they would like to?
I know that many people go to Amazon, and they are available on Amazon.
Great.
And also by going to the American Academy of Neurology website, you can get them as well. You probably know some other sources I'm forgetting.
I think Oxford University Press
Yes.
might be one other, but I think, going to the American Academy of Neurology's website or to Amazon, I think are good places. The books are great. We've covered them in the magazine. They've been really helpful. We've gotten good feedback from some of our readers. So thank you very much,
You're welcome.
and we'll see you next time.